Hi, welcome to Straight Talk. I'd like to first wish everyone a happy and safe holiday season. And on Straight Talk today, we're going to talk about being safe. There isn't anyone that hasn't been affected by crime, by the violence, whether it's personally or whether it's a family member or a friend. We're all concerned about violence. We know that Baltimore has a serious problem. So does every big city in this country. So today on Straight Talk, we're going to talk about some of the root causes of crime and hear about some programs that are trying to make a difference, something that we can all get behind and get supportive and hopefully make a difference. So to start with, we're going to start talking about mental illness and the mental health issue when it comes to crime and prevention, because it's a really big part of what we're talking about. And joining me is Jennifer Treger, who's the Director of Mental Health First Aid, which is part of the Mental Health Association of Maryland. Welcome.
Thank you. Glad to be here.
There's so much to talk about, you know, when we see violent acts and they go, well, he was mentally ill, or there's a history of mental illness, and people want to kind of lump that together and say, well, that's where our crime is, because people are mentally ill. But it's way bigger than that. And I know you do a lot of work in prevention and education. So let's talk about the first aid program before we get deeper into the subject.
Sure. So Mental Health First Aid, a program of the Mental Health Association of Maryland, is an 8-hour national certification program that teaches people how to recognize the signs and symptoms of a mental health concern or crisis, and it teaches a 5-step action plan in how to help somebody. So to assess, is the person at risk for suicide or harm, how to really listen to somebody and have a conversation if you're concerned about their behavior, how to support them, and if there is a need for professional help, how to really encourage them to get professional help. It's really a public education program, so it's a training for everybody. Anybody can be trained in mental health first aid, just like CPR trains somebody to help in that situation. You're more likely to encounter somebody who may be having a mental health concern or crisis. So at a very first aid level, it teaches somebody what they can do to help somebody.
Is there any way to make that mandatory for everyone? Just like CPR should be mandatory for everyone. You would think everybody needs to know that.
Right.
Because again, every time we hear of situations, somebody had an ability or somebody had an opportunity to step in if they knew what to do. And what you're saying is you're trying to teach people how to recognize and then what to do.
Right, because you're more likely to encounter somebody who may be having a mental health concern or crisis than probably somebody having a heart attack. So it's important skills for people to have.
How do you separate between somebody who's, quote, acting out and somebody who may have a serious problem?
That's hard for a lot of people to differentiate between. So we really look for, you know, we all feel sometimes anxious or sad, or, you know, lots of feelings that we all feel. It's when the feelings go on for a very long time, they become very disruptive to the person's life. So when it starts to disrupt their ability to get up and go to work every day, when it starts to really disrupt their ability to just, for self-care, hygiene, taking care of their daily activities, really affecting their relationships for a long period of time, then we're going to start to be concerned. We certainly don't want to diagnose, and in mental health first aid we teach people we're not trying to diagnose, but when we start to feel concerned, how to have that conversation so that we can learn more, and when we learn more, then we can help with the skills that we have.
And if somebody out there is either experiencing those feelings or knows someone that is it important to react quickly when you see that happening and call for help?
Well, it depends on the situation, but what we know when it comes to mental health and mental illness is that the earlier we intervene with somebody, more likely the outcome is going to be better, because we know that people who have mental illness can recover, can get better. What recovery looks like for one person may be different than what recovery may look like for another person, but the earlier we intervene, making sure they have the proper supports, the proper treatment, we know that people can get better. And so it's important that we are talking about it. The more we talk about it, mental illness is very stigmatized because people often think lots of different things, and because of the things we see on the media, it's very stigmatized, and because of that, people might feel afraid to say I'm having these feelings or afraid to get care. So the more that we can talk about it out in the open, the more that we can get people into care quicker.
Who would be the first line response for a family or a parent wants a call? Would it be their family doctor? Would it be a psychiatrist? Would it be a therapist? Who do you recommend that they make that first call and say, I'm concerned because my loved one has these signs and symptoms?
Yeah, so it could be any of the above that you just mentioned. Maryland has a crisis line, 211, that people can call if there's a situation that's a crisis. Most counties have a mobile crisis team, so if there's a mental health concern, they can call a mobile crisis team, and those are people who are specifically trained in mental health that can help somebody in a situation that they may be concerned about. Most health departments have core service agencies that they can also access in their counties. So all of that information can be found on our website, as well as within the different county websites as well.
So it doesn't matter who you call, you just have to make the call.
Yeah.
You can't just sit back and not do anything.
Right, and you want to connect the person to the appropriate care depending on the situation. So that's what, when we teach a mental health first aid, we talk about how to have a conversation, because the more that you know, the more then you can make the appropriate call depending on what's going on with the person.
How do they get hold? I know we've been putting websites up, but if somebody wants to be trained, family or professionals, just call, schedule an appointment, a training?
So Mental Health First Aid is a Train the Trainer course. So we have trained over 32,000 people in Maryland so far, and we have over 450 instructors throughout the state. And so there are a lot of people doing mental health first aid training throughout. The Mental Health Association does a lot of instructor training as well as 8-hour training, so they can visit our website. The Mental Health First Aid website for Mental Health Maryland is MHFAMaryland.org. They can visit that site, and my contact information is on there. People can reach out to me. I'd be happy to connect them if they want to get trained.
Great. Well, I wish you a lot of luck. You know, it's a big problem, and as you said, we want to minimize the stigma and get people help. That's what it's about. So thank you so much for joining us.
Thank you.